Hi everyone, I am Dr. Kiran Kumar, Senior Consultant Neurophysician. October 29th is observed as World Stroke Day. This year's theme is Together We Are Greater Than Stroke. The objective of observing this stroke day is to emphasize the seriousness of the illness and high incidence and prevalence of the strokes in the community, and also to raise the awareness among the general public regarding recent advances in the stroke management and preventive aspects also. Coming to, for a non-medical person, how to recognize stroke. The simple mnemonic is FAST, that is fast. F is facial drooping, and A is arm numbness or weakness. S is slurring of the speech or difficulty in speech. T is time to call emergency. That means once you see any of these three above signs, you have to call the emergency and immediately go to a nearest stroke center or general hospital where stroke can be comprehensively evaluated and treated. Coming to the types of strokes, grossly there are two types. One is, most common is ischemic stroke. That occurs when there is a certain area of the brain is deprived of the blood supply. The tissues slowly they die, brain cells die and result in the neurological deficits, which can be reversible or permanent. And the second one is hemorrhagic, which is less common. That is due to rupture of the small blood vessels. There will be bleeding into the brain substance. What will be done once stroke patient comes to the emergency? Grossly, all will be evaluated with based on the patient's stability and hemodynamic status. They will be evaluated either with plain CT brain or CT cerebral angio or MRI brain with MRI angiography. If it is ischemic stroke, and that means once bleed is ruled out, if they are eligible and they present to the hospital less than 4.5 hours, that means early presentation is always very important. So if they present in less than 4.5 hours and otherwise eligible, we can give the thrombolytic agent altiplase or tenecteplase. So after that, stabilization and blood thinners and lipid lowering drugs and other supportive care, optimizing hypertension and diabetes medication will be continued lifelong. And coming to the warning signs, so few patients directly don't develop full established stroke. They develop the symptoms which are exactly similar to stroke, but they are totally reversible and improve within few minutes and usually less than 1 hour. That is called transient ischemic attack. That also should never be neglected, because most of them progress into established stroke and it should be treated accordingly with antiplatelets and lipid lowering drugs and lifestyle modification and other supportive care. And if required, they should be admitted immediately and evaluated for the underlying cause of the stroke. And there is recent surge in stroke even in young people, especially post-COVID scenario. So we should never think that below 40 years, even you get these symptoms, it can't be stroke. Whenever there is suspicion, immediately you should call the emergency and go to a nearest hospital, and better it should be ruled out rather than delaying it and getting sequelae and more residual deficits. Coming to the preventive aspects. So usually conventional risk factors for stroke is hypertension, diabetes, smoking, alcohol, high cholesterol, of late stressful lifestyle. So in the preventive aspects, we should focus on all these comorbidities. So adequate control of the blood pressure and optimal control of the diabetes, frequent preventive health checkups, and targeting the LDL cholesterol and other triglycerides. LDL especially less than 100 and preferably less than 70 milligram per deciliters, and adequate sleep and a lifestyle modification. Avoid alcohol, avoid smoking, preferably avoid high salt and added salt or red meat, and take plenty of green leafy vegetables, nuts, and reduce the stress. Physical activity at least 30 minutes per day for at least 5 days in a week is recommended. So to summarize, together we are greater than stroke. That means if you give good education and awareness to the general public, and once the patient reach regarding stroke symptoms and management protocols, and once the patient reaches the hospital, if there is a good cooperation between neurology, neurosurgery, and especially interventional radiology, because of late there is an option called mechanical thrombectomy for large vessel strokes where there is a long segment thrombosis which can't be lysed with drugs. There is an option called mechanical thrombectomy. With the endovascular device, we can remove that thrombus such that residual deficits will be minimized and long-term prognosis is good. So with a close collaboration of the emergency team, neurologist, neurosurgeon and interventional radiologist, we can optimize the acute stroke management and give all the latest advances in the treatment options to the patients and reduce long-term morbidity and mortality. Thank you.